Bismillahirrahmanirrahim and Assalamu alaikum. I am Dr. Saima Rashid and today I am giving the lecture on the topic of properties of reflex action. Definition: a reflex may be defined as an immediate involuntary response to a stimulus. A reflex is a fast response to a change in the body's internal or external environment in an attempt to restore homeostasis. Stimulus exists in many energy forms: light, sound, pressure, taste, and chemical changes. Receptors are highly sensitive to one particular stimulus modality, that is, each receptor is specialized to respond to one type of stimulus, which is its adequate stimulus. For example, receptors in the retina of eye are sensitive to light rays, in the ear to sound waves, and heat receptors in skin to hot and cold temperature. Receptors convert stimulus energy into receptor potential, which in turn convert it to action potential. Reflexes and diagnosis. Evaluation of a reflex arc can aid a doctor in diagnosing a problem. A reflex which stops functioning or functions abnormally may indicate that a particular central or peripheral conduction pathway in the body has been damaged. Superficial and deep reflexes. Classification of reflexes. Reflexes clinical classification is based on the deep, visceral, and pathological reflex. Anatomical classification based on segmental, intersegmental, and suprasegmental. Number of synapses is synaptic, monosynaptic, bisynaptic, and polysynaptic. Functional classification include flexor, extensor, writing, postural, withdrawal, whereas last type is the conditioned and unconditioned. Reflex arc. Basic unit of integrated reflex activity is reflex arc. It has five components: receptor, muscle spindle, efferent 1A, 2 fibers, center spinal cord, efferent motor nerve, effector is the extrafusal fiber. This is the diagram that is showing how the command is being given from the sensations are being taken by the sensory nerve pathway to the spinal cord at the interneuron segment, at the integrating segment. This information has been integrated, and now the command has been sent to the antagonist muscles to react according to the specific situation. Ponosynaptic reflexes: stretch reflex, inverse stretch, reciprocal innervation, and clonus. Stretch reflex. When a skeletal muscle with intact nerve supplies is stretched, it contracts. Stretch reflex. Stimulus is a stretch response, contraction, sense organ, muscle spindle. Terminology. In a reflex, the homonymous muscle that contains the sense organ; synergist muscle that produces the similar action; antagonist muscle that produces opposite action. Now, in this diagram, the elbow joint has been shown. The biceps muscle is the homonymous muscle where spindle is located, flexes the elbow, whereas the brachialis is the synergist muscle. It also helps in the flexion of the elbow. The triceps muscle is an antagonist and it extends the elbow. Now this diagram is showing that how the fibers from the spinal cord, the alpha motor neuron, are innervating the extrafusal fiber, that the external component of the muscle, whereas the gamma motor neurons from the spinal cord are innervating the intrafusal fiber. Now, the muscle spindle, the proprioceptors that are present in the skeletal muscle, 6 to 14 muscle fibers, intrafusal fibers in a spindle shaped fibrous sheet. Now, there are the two type of fibers: nuclear bag fiber and nuclear chain fiber. Afferent 1A and 2 fibers: 1A from central part of all fibers, annulospiral ends; 2 only from the nuclear chain fiber, that is flower spray ends. Efferent gamma fibers to both nuclear bag fiber and nuclear chain fiber, and alpha motor neurons supply the extrafusal fiber. 1A and gamma 1 dynamic response, 2 and gamma 2 static response. Now the annulospiral ending is being observed in the nuclear bag fiber, whereas in the nuclear chain fiber the flower spray ending and the trail ending are there. In the nuclear bag fibers there is innervation of gamma and the beta efferent fibers, and there will be the innervation of 1A primary efferent from the nuclear bag fiber too. Now the functions of muscle spindle: maintains the length of muscle fiber at rest or activity, give feedback to higher center for comparing with intended movement, monitor velocity of muscle contraction. Gamma efferent discharge. Now, the efferent fibers are not strong enough or not plentiful enough to cause the shortening of the muscle. Now, it causes shortening through the reflex arc indirectly. Shortening of these fibers is stretch of causing stretch of nuclear back fibers and 1A efferent reflex muscle contraction through alpha fibers. If a muscle is stretched during the gamma stimulation, additional action potentials are stimulated and rate of discharge of one afferent increases. Now the stretch reflex, the response, the that is the stimulus, the biceps muscle is stretch, stimulus fast stretch of muscle, then it with the biceps spindle, the sense organ is excited, the muscle spindle and 1A and 2 sensory neurons will be causing the primary response of muscle, that is stretch, and they contract rapidly biceps. Importance of stretch reflex in production of muscle tone, partially contracted state of muscle, maintenance of posture. In erect posture, gravity tends to flex or the hip or knee. The slight initial flexion stretches the extensor, causing its contraction reflexly. Due to this, man remains standing, mainly in anti-gravity muscles, non-fatigable and simple reflex arc. Typical reflex stimulus, sensory stimulus. Now, the sensory neuron, the typical reflex are the sensory neuron, they detects the stimulus. Then comes the center nervous system, interneuron, integrating system. Now, these interneuron most often can be excitatory or inhibitory. Then comes the motor response, and it produces the muscle contraction, muscle response. The reflexes often have effects or group of motor neurons to different muscles, sometimes different joints or opposite limb. Reflexes. Muscle reflex helps to determine how responsive the spinal cord is. It may be so sensitive that just tapping the tendon of knee with the tip of the finger can cause the leg to jump a considerable distance. If, however, the cord is overwhelmed by the other impulses from the brain, it may be impossible to cause the muscles or tendons to respond. Now, this is the picture that is showing how the nerve fibers of sensory neuron are innervating the muscle. And the whole equipment or whole set of components is termed as the Golgi tendon apparatus. In the next diagram, it is showing one A fiber from the muscle spindle are taking information to the interneuron or the integrating system from the to the spinal cord, and from there from the ventral root, the motor end plate on the extrafusal fiber react according to the command. Mechanism of deep reflexes. When a skeletal muscle with an intact nerve supplies is stretched, it contracts. This response is called a stretch reflex. The stimulus that initiates the reflex is the stretch of the muscle, and the response is the contraction of muscle being stretched. The sense organ is the muscle spindle. The impulses originating in the spindle are conducted in the central nervous system by the fast sensory fibers that pass directly to the motor neurons which supply the same muscle. Effect on posture and balance. This reflex maintain the posture of you while your mind is busy in another thing. Muscle fatigue, stretching, reflex contraction, maintain posture. This occurs when millisecond this occurs within few milliseconds and is called the tonic stretch reflex. Reciprocal inhibition, interneuron interconnecting neurons and inhibitory messages to the motor neuron. This maintains the proper balance for the muscle activity for the postural control, and this is called the reciprocal inhibition. Regular rhythmic contraction of muscles subjected to sudden maintain stretch. Mechanism. In upper motor neuron lesion, the inhibitory effect of the central stimulating system on gamma neurons is lost. So gamma efferent discharges are increased, so the spindles are already hyperactive. When the muscle is stretched passively, bursts of impulses from them discharge all the motor neurons at once. The consequent contraction stops the spindle discharge, but due to sustained stretch, the muscle spindles are again stimulated and it continues. Deep tendon reflexes. Persuade the patient to relax. Position the limbs properly and symmetrically. Strike the tendon briskly using a rapid wrist movement. Your strike should be quick and direct, not glancing. You may use either the pointed or the flat end of the hammer. Grading of reflex. Very brisk, hyperactive with clonus rhythmic oscillation between the flexion and extension. Brisker, grade 3, the average or possibly but not necessarily indicative of disease. Average is normal, somewhat diminished is plus 1, and low normal is also indicated as 1, and no response is 0. Abnormalities. Hyperactive reflex. They suggest the central nervous system disease. Sustained clonus confirms it. Reflexes may be diminished or absent when sensation is lost, when the relevant spinal segment are damaged, or when the peripheral nerves are damaged. Diseases of the muscle and neuromuscular junctions may also decrease the reflexes. Bicep reflex C5 and C6. The patient arm should be partially flexed at the elbow with the palm down. Place the thumb or finger firmly on the biceps tendon. Strike with the reflex hammer so that the blow is aimed directly through your digit towards the bicep tendon. Observe flexion at the elbow and watch for and feel the contraction of the bicep muscle. Now, this is the way how you can strike the biceps muscle by putting your thumb, and you have to strike your thumb rather than that muscle. It might damage the muscle if you directly strike the bicep muscle. Now the tricep reflex, the root value is C5, C6, C7. It flex the patient's arm at the elbow with palm towards the body and pull it slightly across the chest. Strike the triceps tendon above the elbow and use a direct blow from the directly behind it. Watch for the contraction of the triceps muscle and extensor at the elbow. Now this is if how the triceps is being checked. Reflex has been checked. If you have difficulty getting the patient to relax, try supporting the upper arm and ask the patient to let the arm go limp. So if there would be hung up to dry, then strike the triceps tendon. Brachioradialis, the root value C5, C6, the patient hand should rest on the abdomen or the lap, whereas with the forearm partly pronated. Strike the radius about 1 to 2 inches above the wrist. Watch for flexion and supination of forearm. Now, this is the way how brachioradialis reflex C5, C6 is being examined. Now comes the knee reflex L2, L3, and L4. The patient may be either sitting or lying down as long as the knee is flexed. Briskly tap the patellar tendon just below the patella. Note the contraction of the quadriceps with extension at knee. A hand on the patient's interior thigh, let you feel it. Feel this reflex. Now you have to, if the patient is not exhibiting the reflex, you may ask him to close his fist or to clench his teeth in order to divert his attention, and the reflex will be properly exhibited. Ankle reflex S1. If the patient is sitting dorsiflex, the foot at the ankle, persuade the patient to relax and strike the Achilles tendon. Watch and feel for plantar flexion at the ankle. Note also the speed of relaxation after the muscle contracts. And you have to strike the ankle Achilles tendon so that the reflex should be initiated or exhibited. Now, the superficial reflex. Group of reflexes include the plantar response, the superficial abdominal reflex, and the cremastric reflex. These are the polysynaptic reflexes which are evoked by cutaneous stimulation. Plantar response L5 and S1 with an object such as key or wooden end of applicator. Strike stroke the lateral aspect of the sole from the heel up to the ball of the foot, curving medially across the ball. Use the lightest stimulus that will provoke a response, but B is increasingly firm necessarily. Note the movement of the toes, and normally it is flexion. Dorsiflexion of the big toe, often accompanied by fanning of the other toes, constitutes a Babinski response, and it often indicates a central nervous system lesion in the corticospinal or pyramidal tract. This is the way how the Babinski sign is said to be positive. There is the dorsiflexion of the big toe with the fanning of the fingers. Now comes the abdominal reflex. Test the abdominal reflexes slightly by brisking the stroke each side of the abdomen across the umbilicus above T8, T9, T10 and below T10, T11, T12 the umbilicus in the directions illustrated. Use a key wooden end of a cotton dripped applicator and a tongue blade twisted and split longitudinally. Note the contraction of the abdominal muscle and elevation of the umbilicus towards the stimulus. Obesity mask abdominal reflex. In the situation, use your finger to retract the patient's umbilicus away from the side to be stimulated. Feel with your retracting fingers from the from the muscle contraction. This is the way you have to strike the the abdominal skin around the umbilicus, and reflex may be absent in both the central and peripheral system disorders. Thank you. That was all about the superficial and deep reflexes.